Hi, Patrice. How are you today?
Hi, I'm doing good.
Good. I'm glad to see you today, and I'm glad you're here for supervision. I've been looking forward to this. So tell me how things are going with you.
Things are going really good. I got a couple of extra cases that I've been working on since the last time we met. I I did want to say that I was kind of feeling a little overloaded and kind of burnout, and I'm just trying to figure out a balance in between the cases that I'm doing, running running a practice, and then just trying to manage it all. I think is where I'm at, and I'm a little frustrated about that.
Wow, I can bet. So now you're doing the administrative task of running your agency, being the director of your agency. And now the cases that you've taken on, these are clinical cases as well.
Yes,
Oh,
and
wow.
I was trying to get a balance, more because of doing more administrative stuff. I was trying to kind of minimize my cases, my clinical work, and accepting cases. But it seems like I don't know, when something is presented to me and I just feel um, like I want to work with the case and take it on. And I think I don't know if it's me just not really wanting to let go. But I just feel like, when I hear a case, my heart just goes out, and I feel like I want to work with this case, work with this family, work with this person. Um, but then I see myself with my caseload, steady building, getting higher and higher, and still I still have all of my administrative duties as well.
Wow. Well, this is something we've talked about in the past before, Patrice. So I'm really surprised that you've taken on more cases. So why don't you tell me, first off, how many additional cases you've taken and what the total number of clinical cases you would have now?
Well, I've taken on four more cases. So now my caseload, I think clinical work that I'm doing is maybe up to 10, 11 cases.
So you're planning to work on 10 clinical cases and do your full-time administrative work?
Yes, I have been doing it, and I think that's why I'm a little frustrated and burnt out.
Well, I know when we talked before, your administrative load was actually increasing as well because of some plans, new plans that you have at your agency. Is
Right.
that still happening?
Yes, it is.
Okay.
It is.
So what plan do you have to manage all of this? Because I don't see where you would be able to really effectively work on your administrative duties and do 10 additional clinical cases.
Well, and that's kind of really one of the reasons I was really looking forward to this session today, this supervision session, to kind of get some input, or to maybe help me think about um, what's going on, even with me, as far as not, because there are people in the agency that I could clearly refer the cases to, but it just seems like when I hear a case, I just get engrossed in it, and I feel like I want to do the work with this case or with this family. And yes, my duties, administrative duties, continue to pick up. There are new plans, new programs we have coming online, and I'm just trying to find a balance with all of that. But I think I'm at a point now where I know I'm not going to take any more cases on, and maybe just trying to find a way now. I feel like I've taken these cases, and to now transition these cases out, I just clinically don't feel like that's something that I should do. You know, I, I think maybe I should work these cases until I feel like they're ready to be discharged, or okay, opposed to maybe transitioning to someone else within the agency.
Okay, well, let's take a look at this. We've tried to look at this before, and I feel like I hear you're saying now you're ready to really take an honest look at whether or not you'll be effective, because that's what the goal is. It's not just to have the cases and to work the clinical cases, but you want to be effective. You want to be providing the best practice for all of these cases, as well as doing your best as an administrator. Is that right?
Yes, that's right. And I am kind of trying to look more about the bigger picture now. And I don't know if it's maybe, I don't know. I don't think it's, I don't even know if this is right to say, but maybe being selfish, of wanting to keep all of the work. I don't know. I don't know. I don't know if this is something within my own character that maybe I need to really look at, if it's maybe being in control, or, I'm not really sure, but I don't think that's the case. I just think I'm compassionate about what I do and helping people. And so, but I think sometimes that gets me, um, it gets me in a place where I'm not in trouble, but like I'm just exacerbated. I just, you know, sometimes I just have to take a couple of days off from work because I'm so overwhelmed.
Okay. Well, okay. Let's think about this in terms of best practice. And first off, before we go there, I want you to know I think you are a phenomenal clinician. And if you did not have the administrative duties, I think you could do those 10 cases with no problem whatsoever. I also think that you are one of the best administrators that I've ever had the privilege of working with. You're able to look beyond what is now and just forecast things in the future and just really be very proactive about making sure that your agency is above board and just really on top of what you need to be for you guys to progress. So I want you to know that I recognize that in you. And I think those are huge, huge strengths on
Thank
your part. But trying to do them both worries me some because I know you. And I know you want to do your best at both,
Yes.
you know? And so tell me, what does it look like for you to do your best practice administrative wise? Like, what would you need for the outstanding record that you already have to continue?
For one thing, I know it would look like decreasing the caseload, the cases that I'm working with. I don't per se at the moment want to relinquish all of my clinical duties right now because I feel like I still want to be connected in that sense. But I do feel like my clinical, as far as the cases that I'm still involved with, I do think that needs to um, decrease substantially,
Okay.
so that I can focus more administratively on, and that requires time. If I had less cases, it would be less time, and it would be more time I would have to focus on the administrative aspects and moving the agency forward in different directions. But
Okay.
right now, I can't really focus too much on branching out too much because I'm still have this, um, the having to deal with clinical cases.
Right. Okay.
Um,
And let me make clear that your main responsibility to this agency is your administrative ability, right?
right.
That's the position that you're in today is an administrative position.
That's correct.
Okay. So tell me what has happened that you have been faced with accepting clinical cases. What's going on at the agency that you're even hearing clinical cases?
Well, we had clinical staff. We're down one clinical staff, And so we are advertising for clinical positions. And in that interim, um, and I can't even really say because I was willing to take on extra cases. Like I said, when I could have diverted the cases to our other clinician, but I don't know. But maybe I'm thinking when that new clinical person comes on board, maybe I can look at maybe doing some transitioning of my cases to that new clinical person. But I think more as administratively, me trying to make sure everything is covered, I took on these additional cases, and I don't think it really now was a wise decision.
Well, how many clinical therapists do you have at present without the new hire?
3, and we're looking to hire 2 more, so that would give us a total of 5.
Okay. And then what's the average number of cases that your therapists have right now?
The average number, and it just depends on the severity. It could range between 8 to 10. If it's really low service, low need, just maybe touching bases with the family every other week, it could go up to maybe 12 cases.
Okay. Okay. So if they have anywhere from 8 to 10, or let's say 8 to 12 cases, depending on the need. And right now, you have 10 cases, so you have enough cases of your own for at least one other staff person.
Correct.
Okay. But you're looking to hire 2.
Yes.
And where are you on the hiring?
Well, we're in the interviewing process. Someone is in the process of interviewing, but because of the holidays, things kind of came to a standstill. So we will be picking back up with continuing the interviewing process.
Okay. And what how long what is your estimate as far as how long it would take to get someone on board?
It shouldn't take no longer than maybe 7 to 14 days.
Okay. So let's talk about the interim for the 7 to 14 days, because we just talked and you said that you really needed your caseload to be cut substantially. What would be a reasonable amount of clinical work that you would be able to do just in the interim? Like how many cases?
In the interim, well, I'm doing the 10, but I mean, I'm not really like able to effectively focus on my administrative duties. So
right. So that what I'm asking you is to look honestly at the number, the 10 that you have, and how many realistically could you do just for the interim to get you over the hump before your 2 new staff people started. What would be a more realistic number for you?
Probably 2 to 3 cases.
Okay. So let's say 2.
Okay.
Okay. 2 cases you could probably manage in the interim, which is 7 to 14 days.
Right.
Okay. So let's talk about what are the possibilities of the other cases that you have. So we're talking maybe 8 cases.
Yes.
Okay. So what would you do with those 8 cases until you could get those 2 people hired? What are your choices here with the level of care that those cases need?
Well, I could definitely transition them over to the other clinicians, maybe 2 to 3 cases, maybe looking at their caseload and seeing how their caseload looks, and then maybe transitioning those cases over in the interim.
Is there any reason that you wouldn't be able to delegate those cases to those therapists that you have now? Do you feel like they are competent to handle those cases?
Yeah, yes, I feel like they're competent, and it's just, I think this is why this session, this supervision session was important for me because it's really allowing me to think about the bigger picture. And now I'm thinking about, I'm processing with you having me to think about all of this. I'm really thinking about it and now trying to come up with the solution to for this transition to happen. But I definitely feel confident in the clinicians that we have, and I don't think it would be a problem. I think more of the problem was really me just taking on, feeling like I had to take on all of these cases to fill in the gap. But in all actuality, since I'm processing and talking this through with you, I could have actually allowed them to go to the other clinicians.
Okay. Well, I think that's a good plan for now, for you to delegate those cases to the other clinicians. And like you said, looking at their caseloads and the level of care that each case that you have need, maybe you can decide who would be best suited to take those cases. And you could explain that they would have maybe one or two more cases than normal, but just because of the interim, but that within 7 to 14 days, you would have new staff who
Yeah.
would be able to help to balance out their caseload.
Mm-hmm. Yeah, that sounds like a plan. Sounds like a plan.
But let's not totally abandon the fact that you felt like you needed to fill in the gap.
Mm-hmm.
So I would like to hear more about why you felt like you personally needed to do that, because I think we've broached this subject before where
Mm-hmm.
you kind of taking on more duties than you really needed to. So let's look at that for a minute.
Yeah, and I think it's just really, I think I'm type A personality, and I think it's just me always constantly, forward moving, constantly feeling like I have to resolve an issue immediately. Just not being in control, but in control in the sense that just making things happen. And so, and I think it's more of my personality of than anything. And
You've
so, do you
used
think that that's a problem?
you've used the term control about 4 times since we started our supervision. Is there any area that you feel out of control?
I never thought about. I never. You raised that question, but I've never honestly thought that there was an area that I was out of control in, and maybe I need to think about that. I wouldn't think that there is an area because I kind of have a good tab on everything that's going on, and so just off the top of my head, I would not think that there's an area that's out of control for me.
Okay. Well, do you feel like you would be losing anything if you didn't have clinical cases? What would you be losing anything in that area?
Well, I think it's just me as far as the profession, just making sure that um, I'm, still abreast of what's happening in the profession, in the clinical side of it. I feel like if I just totally backed away, that I would lose that.
Okay. So you're, from what I think you're saying is you think you may lose like some of your clinical skill if you didn't keep at least a case or two.
Yes.
Okay. But now, I think last time we talked, you told me that you also provide the leadership for the clinical case meetings that you guys have. Is that right?
Yes.
Okay, so you actually hear every case that comes in and what therapists are working on and what they're doing to address those cases, right?
Right.
How does your clinical skills fit in there?
It's a good question. I mean, I provide, like insight. alternatives to treatment, um, supportive counseling or supportive um, training to the clinicians. And so it does give me a chance when we meet to really talk about clinical aspects of the cases that are here in the agency.
Right. So really, you're not losing your clinical skills by not having a caseload because you're still using your clinical skills amongst your staff.
Right. And I never thought about it that way.
Right. So when they're presenting and you're giving them feedback, and I mean, you have so much knowledge about, clinical work, and then the vast experiences that you've had. So you're really still utilizing those clinical skills, but just with your staff.
Yeah. Yeah. Yeah, that's true.
Okay. So, I think that you're going to just have to reprioritize what your goal is for where you are right now,
Mm-hmm.
and think about that as you continue with this. Is that your goal, from what I understood in our last session, was to be a effective leader
Mm-hmm.
in the administrative position that you have right now.
Right.
Right.
Right. And I know we have a couple of minutes. We're winding down, but one thing I wanted to ask before is that I don't know, do you think that it's wrong for me to focus more on the administrative? Because when I started out in this profession, it was more of helping people, being a level of support, but now to really focus more on, administration, where it's not much of the hands-on working with families. Sometimes I feel like is not really guilty, but it's I guess just coming into maybe understanding that it's okay in this profession that we will transition into many different things or evolve into many different roles in our profession. And then the point that you make, even with me providing clinical guidance to my staff, is still being involved in a certain aspect clinically.
I think that only you can answer that question as far as whether you should be working in an administrative setting or whether you should be working in a clinical setting. I think that's a question that you have to answer yourself. When it comes to helping out the families, I see such a compassionate spirit in you that you want to help the families. And when I hear you're talking about your work with them, I can tell that you really love that. And if you work with families yourself, you can help, 8 to 10 people, clients and their families, um, 8 to 10 per caseload.
Mm-hmm.
But if you work in an administrative arena, then you are pretty much working through the therapists that you have. So how many families would you be able to help with 5 therapists who had a caseload? So I think you're talking about working in a micro versus a macro level.
Mm-hmm. Right.
And so you really are the best judge of which is more satisfying for you.
Mm-hmm. Right.
But I don't think you should. I don't think you should have such a limited view about the fact that if you do it yourself, that you're helping families. I think you have a very limited view about how you're really helping families administratively. Because administratively, as you're hiring therapists and more families are being taken care of and reached
Mm-hmm.
this work, that you're helping more families in that way than you ever could alone.
Yeah, that's a good point. And I think this has helped me kind of change my perception on some things.
So I think it's something that maybe you want to think about more, and you want to really look at this week. And then when we come back next week, you can kind of talk to me about what happened with the staff and where you are with the hiring process,
Okay.
and how you're feeling about your role as an administrator. Because, as you know, both are going to be extremely helpful to clients and their families.
Mm-hmm.
One is more direct care and the other is not. But, you know, when it comes to the usefulness to the clients and their families, they're both very, very important roles.
Right. Right.
And
Yeah.
you just have to decide which role is going to be best for you.
Right.
Okay, so that's something you can think about. Is there anything that we need to talk about that we didn't talk about in this session?
No, I think we covered it all. I think my biggest thing coming into the session was trying to sort through all of my frustration, but I think you've kind of helped me take a new look at my role and what I do, and having a balance to all of that. And so you raised some great points, and I definitely will continue to look at what we talked about.
Well, I think one thing other than that you should also think about is self-care. And what are you doing to really take care of yourself as you're transitioning from a clinical role to this administrative position you're in now?
Mm-hmm.
What are you doing about self-care?
Well, I think I've been so overwhelmed. I was really good at my self-care, spending time with family, going out, exercising, but I've kind of gotten just so boggled down with stuff. I'm in at work early than normal, than the staff, because I'm trying to work on administrative work before we get in the day. And then I have to start seeing clients, and then I'm usually in the office after hours. But I do know that I need to get back to the self-care, because I really felt better overall, mentally, physically. I felt better when I focused on at least once a week just spending time taking care of myself, whether it was going to get a massage, exercising daily, so walking in the park. And so I do know that I need to get back to that.
Okay. Well, good. I'm going to leave you with that then, with self-care. And like I said, contemplating and thinking about which role you best fit in and which role, is most important to you. And we will pick up with this next week when we meet. And do you have everything that you need to work?
Yeah, I think I have everything I need. Yes.
Okay, great. So if anything comes up before next week, please feel free to call me. I have an open door policy, so you can just let me know if you need any help.
Okay, I sure will.
Okay.
Thank you so much.
No problem. Have a good day.
Thank you. Bye-bye.